The trauma room went silent the moment the man hit the gurney. His chest was torn open in 3 places, blood soaking through 4 layers of field dressing, and his pulse was dropping so fast the monitor barely had time to register each number before the next one fell lower. The surgeon took one look and started barking orders. Confident, loud, completely wrong. The quiet nurse standing at the foot of the bed saw it in 4 seconds. She'd seen wounds like this before, not in a hospital. In a valley where the air smelled like cordite and the medevac was 20 minutes out, and 20 minutes was too long. She opened her mouth to speak. The surgeon cut her off without looking at her. "Step back, nurse. The adults are working." If this story has you holding your breath already, hit that like button, follow along so you don't miss what happens next, and drop a comment telling me what city you're watching from. I want to see exactly how far this story travels. The call came in at 1:47 in the morning. Dispatch logged it as a GSW, gunshot wound. Male, approximate age mid-30s, found unresponsive in the parking structure off Kellner Avenue, 2 blocks from the waterfront in Delacroix, Washington. The paramedics who worked him in the field used the word critical 4 times in the radio report, which meant they'd already made their own quiet calculations about his odds and were doing the job anyway, the way good paramedics do. Mercy Hargrove Regional Medical Center received the alert at 1:49. By 1:52, Trauma Bay 2 was prepped and waiting. Nora Tessier was already there. She'd been on since 7 the previous morning, 18 hours into a shift that was supposed to end at midnight but hadn't, because 2 of the night nurses had called out sick and the charge nurse had looked at Nora with that particular expression that didn't ask so much as inform. Nora had said yes the way she always said yes, poured her 3rd coffee of the night, and gone back to work without comment. She was 34 years old, lean in the way that came from a decade of being on her feet 12 hours at a stretch rather than from any deliberate effort. Her hair was pulled back tight. She had a small scar on her left jaw that she never explained and that most of her coworkers had stopped noticing years ago. She moved through the trauma bay the way experienced nurses move, efficiently, with very little wasted motion, checking supply carts and monitor placements without having to think about the sequence because the sequence lived in her hands now. The bay around her buzzed with the particular controlled chaos of a trauma team preparing. 2 residents checked their gloves. A tech ran the IV line. The charge nurse, Delphine Okafor, called out the incoming stats from the paramedic radio feed, her voice steady and practiced. GSW to the torso, exit wound unconfirmed. BP 84/52, heart rate 140, loss of consciousness en route, partial recovery, 2 large bore IVs in the field, saline running wide open, ETA 90 seconds. Nora positioned herself at the left side of the bay where she could see both the door and the primary monitor, and she listened. Not to the numbers were already in her head, but to the pattern underneath them. BP that low, with a heart rate that high, meant the body was working hard to keep blood moving to organs that were starting to protest. The math was not encouraging. The doors blew open at 1:54. The gurney came through fast, paramedics doing a controlled jog, and the patient arrived in pieces the way bad trauma always did. You registered the blood first, then the size of the man, then the specific damage, assembling the picture in the first 3 seconds before your training kicked in, and you stopped seeing a person and started seeing a problem that needed solving. The man was big, 6'1", maybe 6'2", built across the shoulders in a way that hospital gurneys never quite accommodated. He'd been field dressed by the paramedics, but the dressings on his left side were soaked through, and there was a second area of concern near his lower right rib cage that someone had packed with gauze and that was already showing pink at the edges. Single entry wound left lateral thorax, the lead paramedic reported, handing off as the team moved. Exit wound posterior, we think. Couldn't fully confirm. Right side's a secondary, looks like fragmentation or separate impact. He went under twice in the field, came back both times. GCS was 8 on scene, went to 12 in the rig, dropped to 9 about 2 minutes out. The monitor leads went on, the numbers populated on the screen. Nora looked at them and felt something tighten in her chest that had nothing to do with anxiety, more like recognition. The pattern was specific. She'd seen it before in a context that had nothing to do with emergency medicine, or at least not the kind practiced inside buildings. Dr. Garrett Finch arrived 40 seconds later.
out.
He came through the door the way he always did, moving like the room should be grateful for his presence, which it usually was, because Garrett Finch was genuinely good at what he did, and he knew it, and those two facts had fused somewhere along the way into something that sometimes made him hard to be around. He was 46, trim, with the kind of silver at his temples that photographed well and that he was not unaware of. He had trained at 3 prestigious programs published in journals that mattered and had been recruited to Mercy Hargrove 2 years ago with a contract that made the department head visibly uncomfortable every time compensation came up at staff meetings. He was also, on his best days, the best trauma surgeon in the building. He assessed the patient in under 10 seconds, the way surgeons are trained to do, pulling on gloves as his eyes moved over the field. Okay, left thoracic entry, possible hemothorax, secondary right-sided involvement. Let's get a chest x-ray and start the massive transfusion protocol. Somebody get me a thoracostomy tray. Nora was already moving toward the patient's right side, her eyes on the lower rib cage where the secondary packing had been placed. Something about the angle of it bothered her, the location, the depth, the way the bruising around it spread in a specific pattern. She'd seen fragmentation injuries before. This didn't read like fragmentation. "Dr. Finch," she said. Her voice was level, not loud, not urgent, just clear. "I want to flag something about the right-sided injury, the bruising pattern, and the location of the—" "I've assessed the patient, Tessier." He didn't look at her. He was talking to the resident across the table. "Type and cross, 4 units of PRBCs, 2 FFP. Get me that chest film." "The right side may be a separate penetrating wound," Nora said. "The bruising doesn't follow fragmentation scatter. It's Tessier." Now he did look at her briefly, the way someone looks at a door that keeps opening when they didn't ask for it. "I need you focused on monitoring, not diagnosis." "Can you do that?" She held his gaze for a beat. Around them, the team moved and the monitors beeped and the blood pressure continued its slow descent. "His pressure is dropping faster than the left side injury alone explains," she said. "His pressure is dropping because he's been shot." Finch turned back to the resident. "Let's move." Nora stepped back. She did not argue further. She moved to her monitoring station and kept her eyes on the numbers and on the patient, and she thought about what she was looking at and why it looked familiar, and where, exactly, she had seen wounds positioned at precisely that angle and depth before. The answer came to her while they were setting up for the chest x-ray. She'd seen it in field triage. Specifically, she'd seen it in penetrating trauma from a blade rather than a projectile. A narrow high-force insertion that could look superficially like fragmentation damage, but behaved entirely differently inside the body, because it targeted specific spaces rather than scattering through tissue. The bruise pattern around a blade wound spread in a particular way. Elliptical. Specific. The pattern on this man's right side was elliptical. She looked at him, the big frame still and pale against the gurney, the way his hands lay. Even unconscious, even nearly dead, there was something deliberate about how this man occupied space. His left forearm was turned slightly outward, and she could see the edge of a tattoo that had faded with years, but whose design she could still make out. Not decorative, the kind of marking that meant something specific to a specific group of people. She looked at his right hand, at the thick callus on the knuckle of his index finger, at the slightly flattened pad of his thumb, at a pale, wide scar that crossed his wrist in a pattern she recognized because she had seen it made once on a man who had caught a wire line in darkness at 30 feet and caught himself before he went into the water. Her eyes moved to his neck, to another scar, smaller, positioned exactly where someone would need to reach to sever a communications line quickly. She looked at the chest x-ray result when it came up on the monitor. The left side told the story Finch had already been reading, blood accumulating in the pleural space, lung partially compressed. That was real, that was serious, that needed to be addressed. But the right side showed something that made her go very still. There was air where there shouldn't be air. A small, specific pocket of it, high and lateral, positioned in a way that wouldn't have been visible without knowing exactly where to look. The kind of injury that could sit quietly for 40 minutes and then open up without warning. She spoke without raising her voice. "Dr. Finch, right side, upper lateral. There's a small tension pneumo developing. It's not visible on a quick scan, but it's on the film." Finch was looking at the left side. His plan was already assembled in his head, and he was moving pieces into place, and she could see from the set of his shoulders that he heard her the same way you hear something that doesn't fit the picture you've already committed to, registering it and filing it away as interference. "We'll monitor the right side," he said. "It'll tension within the next Tessier." His voice dropped a register. Not shouting. Colder than shouting. "If you cannot perform your assigned role without interrupting my assessment, I will ask you to step out of this bay and send in someone who can function within a team. Is that understood?" The bay went quiet in the particular way spaces go quiet when something has been said that everyone will remember. Nora looked at him. She looked at the monitor. She looked at the man on the table, who had not moved, whose blood pressure was now reading 78/46. "Understood," she said. She stepped back. 40 seconds later, the patient seized. It wasn't a full tonic-clonic. More precisely, there was a sudden violent drop in the patient's oxygen saturation, 94% to 81 in under 10 seconds, accompanied by a sharp spike in heart rate and a shift in his breathing pattern that the monitor captured as an irregular waveform. His right hand clenched once against the gurney rail. His head moved fractionally to the right. The room accelerated. Finch responded to the O2 drop immediately, ordering supplemental, moving toward a procedure that would address the left side's confirmed hemothorax. He was good. His movements were clean and fast, and he was doing exactly what his training told him to do. He was doing it for the wrong side. Nora moved. She didn't announce it. She didn't ask permission. She crossed the bay in 4 steps, reached past the junior resident who was fumbling with a tray setup, and put her hand on the patient's right lateral chest with a specific pressure that she was not supposed to know how to apply, and that she applied anyway, 3 fingers finding the space between the 3rd and 4th ribs in the upper lateral field, while she talked to the resident without looking at him. "I need a 14-gauge needle, 10 centimeters now." Unopened. The resident blinked at her. "Now," she said, same volume, no variance. He handed her the needle. What she did next took 11 seconds. Later, when the evening's events were reviewed and re-reviewed, the number of people in that room who could describe exactly what she did was smaller than it should have been, because none of them had seen it performed that way. Without an ultrasound guide, without confirmation beyond physical examination, in a specific intercostal space that she found by feel as much as anatomy. She inserted the needle at an angle that was not in any standard procedural manual, or rather was not in any civilian procedural manual, and the hiss of escaping air was immediate and unmistakable, and the patient's oxygen saturation stopped falling at 77 and began slowly to climb. She kept one hand on the needle's position and looked at the monitor. 79, 83, 88. Finch had stopped moving. The room was very quiet except for the monitors and the soft sound of the patient's breathing changing, shifting from the shallow, labored work of someone running out of room to something that still had a long way to go but was no longer actively losing ground. "You need to stop," Finch said. His voice had a quality she hadn't heard from him before. Not rage. Something underneath rage that was harder to name. "His SAT is coming up," she said. "He has a tension pneumo on the right side. It was in the film." She kept her eyes on the monitor. "I need someone to get me a chest tube tray so we can—" "You performed an unsanctioned procedure on my patient." Finch stepped toward her. "You put a needle into his chest without authorization from the attending. Do you understand what that means legally? Do you understand what you just did?" "His oxygen saturation was 77, she said. "It's 89 now." "That is not the point. That is exactly the point." The monitor showed 91. The patient's heart rate was coming down from its peak. His blood pressure was still low. It would need to stay low on her list of active problems. But the catastrophic dive had stopped. Finch looked at the monitor. He looked at the patient. He looked at Nora with an expression that had several layers to it, the top one being professional fury, and the ones beneath it being more complicated and less something he would ever say out loud. He turned to the team. "Get a chest tube tray, we're going bilateral." He pointed at Nora without looking at her. "You, step out. I'll be speaking with your charge nurse before this room clears." Nora removed her hand from the needle, ensured the position was maintained, and stepped back. She stripped her gloves. She looked at the patient one more time, at the rise and fall of his chest, which was steadier now, at the monitor numbers, which were not good but were no longer a countdown, and she walked out of the bay. In the hallway, she stood with her back against the wall and breathed. Delphine found her there 8 minutes later. "He called," Delphine said. She was a tall woman, Delphine, with a face that held things without showing them. She'd been charge nurse at Mercy Hargrove for 11 years, and she'd seen most varieties of bad night. She looked at Nora with an expression that was equal parts assessment and something more personal. "You know what he said." "I know what he said." "Nora." Delphine stopped, started again. "Did you have a basis for that intervention?" Nora thought about how to answer that, about the needle in the intercostal space and the angle she'd chosen, and the three-finger positioning that she'd learned not in a simulation lab, but on a mountainside at altitude in the dark, from a man who said you didn't need an ultrasound if you'd done it enough times that your hands remembered what correct felt like. About the tattoo on the patient's forearm and the scar on his wrist. About the fact that she had kept her mouth shut about both of those for the same reason she kept her mouth shut about most things. "Yes," she said. "The patient is stable?" "He is now." Delphine was quiet for a moment. Then, "Finch is filing a formal complaint tonight. He's characterizing it as an unauthorized procedure performed contrary to attending direction, potentially endangering the patient." Nora nodded. She had expected this. Expecting something didn't make it weigh less. "He's going to push for suspension pending review," Delphine said. "I know. Is there anything you want to tell me? Anything that would—" "Not tonight," Nora said. She said it gently, the way you say something when the answer exists but the time for it isn't now. "Tonight, I just want to know he's stable." Delphine looked at her for a long moment. Then she nodded once and walked back toward the nurse's station. Nora stood in the hallway. Through the small window in the trauma bay door, she could see the movement of the team around the patient, the organized activity of people managing someone who was still in serious condition, but was no longer, as of 11 seconds ago, on a particular trajectory that ended one way. She watched them work on him, the big, still body on the table, the faded tattoo on his forearm, the specific angle of his jaw, which she couldn't see clearly through the window, but which she'd registered in the bay, a shape that her memory had filed somewhere and was now retrieving without her permission. She told herself it was coincidence, that a tattoo and a scar and a wound angle and a jawline were not enough to know anything. She told herself that, and she didn't entirely believe it, and she stayed at the window for another minute anyway, watching until the monitors held steady and the team's body language shifted from emergency to sustained management, and she knew he wasn't going to die in the next hour. Then she went to get her fourth coffee of the night. Pops. At 3:15 in the morning, Mercy Hargrove's administrator on call received a formal complaint from Dr. Garrett Finch, time-stamped and CC'd to the department head and the chief of staff. The complaint detailed an unauthorized needle decompression performed by nursing staff contrary to attending direction, in a manner that Finch characterized as reckless and potentially grounds for immediate suspension. He had attached a summary of the clinical timeline as he understood it, which contained several details that were accurate and one significant omission. The omission was the chest X-ray and what it showed in the upper right lateral field. Nora was not told about the complaint that night. She found out at 6 a.m. when Delphine met her at the shift change with a look that said more than the words that followed it. "They want you off the floor pending review," Delphine said. "Effective beginning of day." Nora had been in medicine long enough to know that this was not the end of anything. It was a kind of opening, the kind that looked like a door closing but wasn't necessarily, depending on what happened next. She handed Delphine her badge and walked to her locker and got her jacket. On her way out of the building, she passed the door to the ICU, where the overnight charge nurse was updating boards. She stopped. She asked quietly about the patient from Trauma Bay 2. "Stable," the nurse said. "Holding. They moved him to a monitored room around 4. Nora nodded. She walked out through the automatic doors into the gray pre-dawn of a Delacroix morning, where the air smelled like salt water and rain, and she stood on the sidewalk for a moment with her hands in her jacket pockets. In the monitored room upstairs, the man with the faded tattoo and the wrist scar was breathing on his own, slowly and with difficulty, but breathing. His oxygen saturation was 93%. His blood pressure remained low, but had been stable for 90 minutes. Nora didn't know his name. She didn't know for certain who he was or why he had been lying half dead in a parking structure 2 blocks from the waterfront at 1:47 in the morning. But she knew, with the certainty of a person who has made a study of specific kinds of damage and specific kinds of men, that whoever he was, he had not ended up on that gurney by accident. And she knew that when he woke up, if he woke up, certain questions were going to need answers that a hospital room was not built to contain. She walked to her car. Behind her, the automatic doors slid closed. Upstairs, the monitors held. She drove home in the dark and didn't sleep. Not really. She lay on top of the covers in her clothes and stared at the ceiling and listened to the rain pick up against the windows, which it did around 4:30 and didn't stop. Her apartment was on the 3rd floor of a building near the rail yard, and the windows faced east. So in the mornings when the sky cleared, she got light early, but this morning the sky didn't clear and the light came anyway. Gray, flat, diffuse, the kind of light that made everything look temporary. She got up at 7 and made coffee and stood at the kitchen window and thought about the chest x-ray, about the upper right lateral field, about the pocket of air that had been sitting there, invisible to someone looking for something else, developing on its own schedule, while the team focused on the left side and the clock ran, and nobody but her looked at the film with the particular kind of attention that came from knowing what you were looking for. She thought about what Finch had put in the complaint and what he hadn't. Then she stopped thinking about it, because thinking about it wasn't going to change it, and she needed to eat something, and she needed to decide what came next. What came next, practically speaking, was a call from the hospital's HR department at 9:43, informing her that a formal review had been initiated and that she was placed on unpaid administrative leave pending outcome. The woman on the phone read the language from what sounded like a template and spoke in the careful tone of someone who has had training on how to deliver bad news without creating liability. Nora listened without interrupting. When the woman finished, Nora asked 2 specific questions: whether she was entitled to review the complaint as filed, and whether she could access her own incident documentation from the shift. The woman said she would follow up on both. She had not followed up by noon. Nora called her union rep, left a message, and went for a run. She ran the waterfront route, 4 miles along the harbor where the working boats sat low in the water and the air smelled like diesel and brine. And she ran it at a pace that most people would have found uncomfortable to sustain, which she found steadying in the specific way that physical effort had always been steadying for her. Not escape. More like maintenance, the body doing what it was built for so the mind could work without friction. She thought about the patient while she ran, about the way he'd been positioned on the gurney, the specific muscle development across his upper back, the bilateral wear pattern she'd noticed on his hands, about the tattoo. Old Navy ink, she was almost certain, but the design had a secondary element overlaid that was newer and less standard, the kind of modification that meant something to a closed group and nothing to anyone outside it. She thought about the blade angle on the right side wound. Someone who knew what they were doing had put that in there. High force, narrow profile, inserted at an upward angle designed to miss the obvious organs, and instead compromise the pleural space slowly, the kind of wound that would look manageable for the first hour and then open up, which was exactly what had nearly happened. It was not a fight wound. It was not a robbery wound. It was a wound designed by someone with training, placed deliberately, intended to kill on a delay so that whoever had placed it could be somewhere else when it happened. She finished the run and stood at the end of the pier with her hands on her knees and her breath visible in the cold air, and she thought about all of it together and what it added up to. Then she walked back to her apartment and showered and called the hospital again about her documentation request. The man in room 4 North woke up for the first time at 11:22 that morning. Not fully. It was more of a surfacing, the kind of semi-consciousness that follows serious sedation and serious blood loss, where the world comes back in segments and none of the segments quite connect yet. He registered light first, then sound, the specific rhythm of a cardiac monitor, which he had enough residual awareness to recognize and to understand what it meant about where he was. Then the weight of his own body, which felt wrong in the particular way it felt wrong when something significant had been done to it. He didn't move. He had enough training left, even at the bottom of a sedation fog, to know that waking up in an unknown location required assessment before action. He listened, counted sounds, registered 2 staff voices in the hallway, both female, both relaxed in cadence, not alert, not responding to anything. He registered the particular quality of filtered air that meant a climate-controlled medical environment. He registered no immediate threat signatures. He opened his eyes. The ceiling was acoustic tile. The light was indirect fluorescent. There was an IV line in his left arm, and monitoring leads on his chest and a pulse oximeter on his right index finger. His right side ached with a deep, specific pain that he recognized as managed rather than active. Something had been addressed there, something that had been worse. He turned his head slowly to the left. Empty chair to the right. Window, rain, gray sky over what looked like a mid-sized coastal city. A building across the street with a medical supply logo on the awning. Washington State, probably, based on the particular shade of green on the hillside visible at the far edge of the window. He tried to remember how he'd gotten here. It came back in pieces, the way things always came back when the brain had been briefly deprived of what it needed. The parking structure, the wet concrete, the sound he'd made when he went down that he hadn't intended to make. The phone he'd managed to reach before everything narrowed to a point. The voice on the other end that had said, stay on, we're coming," in the flat professional tone of someone who had said it before. He didn't know if they'd come in time. He was apparently alive, which suggested they had, or that something else had intervened. He lay still and breathed and waited for his mind to finish assembling itself. A nurse came in at 11:35 to check his vitals. Young, efficient, not unkind, clearly not expecting him to be conscious. She startled slightly when she found his eyes open. "Good morning," she said, recovering. "I'm going to need to let the attending know you're awake. Can you tell me your name?" He looked at her for a moment. "Callum," he said. His voice came out rougher than he'd have liked. "Callum Reese." She wrote it down. It was not his name. Nora found out he was awake at 2 in the afternoon when Delphine called her. Delphine was not supposed to be calling her. Administrative leave meant no patient contact, no access to records, no involvement in ongoing care. Delphine was aware of all of this. She called anyway, from her personal cell, and what she said was, "Your patient from last night is awake and asking questions." "What kind of questions?" "About who treated him, specifically about the overnight trauma team." A pause. "He asked about the nurse." Nora was quiet for a moment. "What did he ask?" "He asked if she was still in the building. Something about the phrasing of that. Not who was she or what's her name, but is she still in the building?" Made the back of Nora's neck prickle in a way she'd learned not to dismiss. "Delphine," she said carefully. "Who else knows he's awake?" "The attending assigned this morning, the floor nurses. Finch was notified because he was the trauma attending of record." Another pause. Longer. "There were 2 men in the lobby this morning, Nora. Not family. They weren't wearing anything identifying. They asked at the front desk about a patient brought in last night with a gunshot wound, and then when the desk told them we couldn't confirm patient information, they sat down and didn't leave. Nora didn't say anything." "They're still there," Delphine said. "Are they law enforcement?" "I don't know. They don't look like cops. They look like—" Delphine stopped. "I don't know what they look like. They look like men who are very good at looking like nothing in particular." Nora sat with that for a second. "Don't tell anyone else he's awake yet. Can you do that?" "I'm already not doing a lot of things I'm technically supposed to be doing," Delphine said, with something that wasn't quite humor. "I'll add it to the list." The call ended. Nora sat at her kitchen table and looked at her coffee, which had gone cold, and thought about 2 men in a lobby who were good at looking like nothing, and a patient who wanted to know if the nurse was still in the building before he'd asked anything else. She got her jacket and her keys. She didn't go in through the main entrance. Mercy Hargrove had a secondary access route through the imaging department that staff used during high traffic periods, and Nora had been using it for 4 years and had a badge that technically no longer worked, but that the side door's reader had not yet been updated to reject. A lag in the system that IT had been meaning to address for months. She went in through imaging, took the stairs to 4, and walked the long corridor to 4 North with her badge clipped to her jacket and her pace deliberate. The way you moved when you wanted to look like you were supposed to be somewhere, rather than like you were trying to get there without being seen. The room was at the end of the corridor. The door was partially open. She could hear the floor nurse at the station 20 feet behind her finishing a phone call. She pushed the door and went in. He was awake, more fully awake than she'd expected, sitting up at an angle the bed's adjustment allowed, IV still in place, monitoring lead still attached, but with the particular quality of alertness that she recognized from a specific context. He'd been watching the door. When she came through it, his eyes moved to her immediately, assessed her in under 2 seconds, and then did something she had not anticipated. He relaxed. Not completely. Not the way someone relaxes when a threat is removed, but the way someone relaxes when a variable resolves, when something uncertain becomes known. His shoulders dropped a fraction. His right hand, which had been resting near the call button, moved away from it. He knew her. She was sure of it before he said anything. The recognition was too specific, too fast, too immediate to be anything else. She'd walked through a door and he'd seen her, and something inside him had settled, which meant he hadn't just been asking if the nurse was still in the building. He'd been asking about her specifically, which meant he knew who she was, which meant he'd known before he was brought in, or had assembled it from something, or... "Commander," he said. His voice was low and rough from the intubation and the blood loss and everything his body had been through in the last 9 hours. But the word was precise, not a guess, not a question framing itself as a statement. She stood inside the door and looked at him and said nothing for a moment. His face. She'd registered it in the trauma bay, the jaw, the specific angle, but in the harsh lateral light of 2 a.m. and the chaos of the bay. It had been data, one input among too many. Now, in the gray afternoon light of a hospital room, with his eyes open and his face clear of the mask of unconsciousness, she placed it. It took her 3 seconds, and then it landed like a door closing. "Reese," she said. He shook his head slightly. "Van, Sergeant Marcus Van. You wouldn't know that name. I was 3 years after your time." He stopped, marshaling breath. "But you pulled 2 of my people out of a building in—" "Don't say the location," she said, quickly, reflexively. He stopped. The corner of his mouth moved. "Right." She came further into the room and let the door close behind her. She looked at him, really looked, the way she hadn't allowed herself to in the bay because she'd been working, and working required a specific kind of not looking at the person and only looking at the problem. He was in his mid-30s, lean under the hospital gown, in the way that was bone-deep rather than gym-built, with the kind of face that had been weathered into angles. He had a vertical scar above his right eyebrow that was at least 5 years old and hadn't been treated properly at the time, which tracked. "Your name on the intake form says Callum Reese," she said. "It would. Which means someone knows you're here under a cover ID or you're running dark." "Both," he said. "Partially." He shifted and winced, couldn't fully suppress it. "The people who know I'm here under the cover ID are mine. The people who know I'm here, period, are—" He paused. "That's a shorter list than it should be. There are 2 men in the lobby." His face didn't change, but something behind his eyes did. "When did they arrive?" "This morning, early." "Describe them." She did, with the economy of someone who'd been trained to observe and report without editorial. He listened without interrupting. When she finished, he was quiet for a moment. "That's a problem," he said. "What kind?" "The kind I need to make a phone call to address." He looked at the IV line in his arm, then at the monitoring leads on his chest. "How mobile am I, realistically? You had a hemothorax and a tension pneumothorax in the same night. You lost over 1.5 liters of blood. You're not mobile. How mobile do I need to be to use a phone?" "That's not the same question." "No," he agreed. "It's not." He looked at her directly. "I need to contact my chain. There's a protocol for my situation, and I can't initiate it without a secure line, and I don't have one because my equipment didn't make it to the hospital with me." He paused. "I also need to tell you something that affects you directly." She waited. "The people in the lobby," he said. "They're not law enforcement, and they're not here for me specifically. They came in asking about a GSW patient because that's a broad inquiry. They might not know which facility yet. They might be running a sweep. He stopped to breathe. But if they identify me, and they identify who treated me, they will work backward, to anyone who might know anything about my situation. The room was quiet. Nora could hear the cardiac monitor marking his pulse, steadier than it should have been, given everything, which said something about what he was made of. "I'm on administrative leave," she said. "I was suspended this morning by the hospital." Something shifted in his expression. "Because of last night." "Because of last night." He was quiet for a moment. Then, "The doctor, the one who—" He filed a formal complaint. "He's characterizing what I did as an unauthorized procedure that endangered the patient." She said it flatly, without inflection, because that was the only way she could say it right now. Marcus Van, Sergeant Marcus Van, 3 years after her time, whose people she had pulled from a building in a place she wasn't going to name, looked at her with an expression that had several things in it, the top one being something that was almost anger, and the ones beneath it being more complicated. "I was conscious," he said. "Briefly. In the bay. I heard what he said to you." She didn't respond. "I also felt what you did." He gestured minimally toward his right side. "I know what that procedure is. I've had it done once before, in conditions where nobody was arguing about protocol." He paused. "You saved my life, and then someone punished you for it. That's one version of it. It's the accurate version." She looked at him. "Get some rest, Sergeant. You've been through the—" "There's a recording," he said. She stopped. "In your hospital's system. The trauma bay has AV recording for training and liability review, standard in facilities of this size." He held her gaze. "If anyone pulls that recording and watches what actually happened, the timeline, the chest film, the sequence of the intervention, your attending's version of events falls apart." She knew this. She had known it since this morning. She had also known that records could be altered, that footage could be reclassified or degraded or simply not surfaced, that institutions have a way of finding the version of events that creates the least disruption for the people who are still employed. "That recording," she said carefully, "has to be requested through an official review process, which is controlled by the same administration that accepted Finch's complaint." "Not only through official process," he said, "not if the right people request it." She looked at him for a long moment. "Make your phone call, Sergeant," she said. "I need a phone." She took hers out of her jacket pocket and held it for a second. Then she put it on the table beside his bed. He looked at it. Then he looked at her. "This will log a call to a number that you would not be able to explain in a standard review." "I'm already suspended," she said. "I'll manage." She walked to the window and looked out at the rain and listened to him dial. He made 2 calls. She didn't look at him during either one, and she didn't listen closely enough to retain specific content, which was a discipline she'd spent years developing and that came back like muscle memory, present in the room, out of the conversation, storing only what she would need later. When he was done, he said, "They're coming." "How long?" "Depends on where they're staged." He paused. "Not long. My situation had a contingency plan. It just needed to be activated." Another pause, longer. "I need you to stay away from the lobby for the next few hours." "I'm not supposed to be in the building at all." "Then you should probably leave," he said, "and come back tonight." She turned from the window. He was watching her with the careful attention of someone who had long ago learned to read people as a professional necessity and who is currently reading her in a way that she found mildly unsettling in its accuracy. "Why tonight?" she said. "Because by tonight I'll have more information, and because by tonight whoever filed that complaint against you may have a problem of his own to manage." She looked at him. "What kind of problem?" "The kind that comes from treating a patient and then misrepresenting what happened in official records." He said it evenly, without theater. "You're not the only one who was in that bay. There are 6 other people who were in that room, and I was there too for part of it. And I'm not a nobody who wandered in off the street." She held his gaze for a moment. "I don't want anyone's career destroyed on my account." "What you want," he said, "is for the record to reflect what actually happened. Those aren't the same thing." He shifted again, and this time didn't quite manage to conceal the pain it cost him. "Go home, Commander. Let me make some more calls." She picked up the phone from the table, checked it, set it back down. Keep it. You'll need it more than I do tonight. She walked to the door. Tessier, he said. She stopped. The night you pulled my people out. His voice was quieter now, lower, the effort of the last 20 minutes starting to show in it. Morales had a daughter. She was born 6 weeks after we got home. He named her after you. She didn't turn around. She stood with her hand on the door and let that land in whatever part of her received that kind of information, which was a place she kept mostly closed, and that didn't open easily. Tell Morales I said congratulations, she said, 4 years late. She went out. In the corridor, she walked back the way she'd come. Steady pace, eyes forward. And she was almost at the stairwell door when she passed the nurse's station and saw Delphine behind the desk, who looked up and then deliberately looked back down at her computer without acknowledging that she'd seen anything. Nora took the stairs. In the lobby, as she crossed toward the imaging department exit, she kept her eyes forward, but her peripheral vision was trained, and it caught them without her having to look. 2 men in the waiting area to the left of the main desk, sitting with the specific quality of stillness that was not patience but readiness, the kind of stillness that had somewhere else built into it. One was reading something on his phone, the other was not reading anything. He was watching the elevator. Neither of them looked at her. She went through the imaging corridor and out the side door and into the rain. Her car was parked 2 blocks away. She walked to it without hurrying and got in and sat with the engine off for a moment, watching the rain track down the windshield, and thought about what Marcus Van had said. By tonight, whoever filed that complaint may have a problem of his own to manage. She thought about Garrett Finch, about the way he'd said, "Step back, nurse, and I'm the doctor here, and do you understand what you just did?" All of those phrases delivered from a position of certainty, from the deep assurance of a man who had never been wrong in a room where he was supposed to be right, and who had constructed his entire professional identity on that foundation. She thought about a foundation and what happened to a building when it turned out the ground it sat on was not what the builder had believed it to be. Then she started the engine and drove home. She was almost there when her personal cell rang. Unknown number. She almost didn't answer. She answered. Silence for a second, then a voice she didn't recognize, the male, controlled, the tone of someone accustomed to speaking without wasted words. "This is Kendrick. I work with Sergeant Van. He asked me to reach you." "I know who you are," she said, which wasn't strictly true but was close enough. "We've accessed the traffic camera system in the 6-block radius around the facility," Kendrick said. The 2 individuals in the lobby arrived in a vehicle registered to a shell company with links to a private security contractor called Meridian Group. A pause. "You should know that Meridian operates in adjacency to several government programs. They are not official, but they have resources." "What are they looking for?" "Sergeant Van, initially. But they also have interest in anyone who treated him and who might have information about his condition or mission status." Another pause. "Ms. Tessier, I need to know if anyone else at that hospital is aware of the sergeant's true identity." She thought about Delphine, about the overnight charge nurse who'd told her his oxygen saturation, about the 6 people in the trauma bay. "Not yet," she said. "That needs to stay that way," Kendrick said. "Can you ensure that?" "I'm on administrative leave. I don't have a lot of reach inside that building right now." A brief silence. "We're aware of your situation." His voice shifted, not warmer, but more direct. "We're also aware that the complaint filed against you contains a misrepresentation of clinical events. We've obtained a copy of the attending's formal statement and cross-referenced it against the Bay's recording system." Nora felt something very still move through her. "The recording exists," Kendrick said. "All of it. And it doesn't match what Dr. Finch wrote." She pulled into her parking space and sat in the car with the engine running and the rain loud on the roof. "What happens now?" she said. "Now we determine how much of this can be managed quietly," he said, "and how much of it can't." She didn't say anything. "Ms. Tessier," his voice dropped slightly. "By tomorrow morning, some things are going to change at Mercy Hargrove Medical Center. I want you to be prepared for that. And I need you somewhere safe tonight." Her hand tightened on the phone. "Why tonight specifically?" But the line was already dead. She sat in the car for another 2 minutes after the call ended, listening to the rain, running the sentence back through her head. I need you somewhere safe tonight. The word safe was doing a lot of work in that sentence. People who operated in the spaces Kendrick operated in did not use that word casually, and they did not deploy it as a comfort measure. They used it when the alternative was a specific and considered risk, which meant that whatever the Meridian Group was looking for when they ran their sweep of coastal medical facilities, and whatever they'd found or hadn't found yet, someone on Van's side of things believed the situation had moved past the point of quiet resolution. She drove back out of the parking space and kept driving. She did not go home. She went to a motel 4 miles from her apartment, paid cash for 2 nights, and sat on the edge of the bed in a room that smelled like industrial cleaner and stale air, and she thought. She did not unpack anything because she hadn't brought anything, which was either good instinct or a problem she'd address in the morning depending on how the night went. At 8:15, Kendrick called again. The 2 men left the hospital at 6, he said, without preamble. They didn't get what they were looking for, but they pinged an intake nurse who mentioned a second patient inquiry from the overnight desk log. Someone called the hospital at 5:40 this morning asking about GSW admissions before the men arrived. Different number, different approach, same objective. A pause. Someone is running parallel searches. Meridian? Possibly a second contractor. Possibly Meridian running 2 vectors. We don't know yet. He paused again. Sergeant Van is being moved tonight. Medical transport, controlled, are people on both ends. He's stable enough for a short transfer, and staying in a civilian facility is no longer advisable. Is he well enough to move? No, Kendrick said flatly. But the alternative is worse. A brief silence. Before he transferred out, he asked me to tell you something. She waited. He said the doctor, Finch, filed an addendum to his complaint at 4 this afternoon. He added a claim that you accessed the patient's room this afternoon without authorization, which would constitute a secondary violation on top of the primary complaint. A pause with weight in it. He has a witness. One of the floor nurses apparently saw you in the corridor on 4. Nora closed her eyes briefly. The nurse's station. The moment Delphine had looked up and looked back down. It hadn't been Delphine. Someone else had been there. She hadn't registered them because she'd been focused on getting to the stairwell. What does the addendum change? She said. It accelerates the review timeline. The hospital's legal team is now involved, not just HR. And there's talk of involving the state nursing board. Kendrick's voice remained level throughout, delivering each piece of information as data rather than catastrophe. Dr. Finch appears to believe that the more quickly and thoroughly he buries this, the better his position. He's not wrong about the logic. He's wrong about the available material. The recording, Nora said, we have a clean copy. Time-stamped, chain of custody intact. He paused. But using it requires bringing it into an official proceeding, which requires someone with standing to introduce it, which, given the nature of Sergeant Van's mission, is complicated, she said, significantly. She looked at the water-stained ceiling of the motel room. Outside, the rain had not stopped. It felt like it had been raining for weeks. What do you need from me? She said. Right now, stay where you are. Don't go back to the hospital. Don't contact Finch or anyone in hospital administration. A pause. And don't be where you're expected to be. I'm already not. Good, he said, and the call ended. She didn't sleep well, but she slept some, which was enough because she'd learned a long time ago that the body could operate on less than it wanted if the mind was disciplined about it. At 6 the following morning, her phone rang with a number she didn't recognize, but answered because she'd been answering unknown numbers for the past 18 hours, and stopping now seemed like poor logic. The voice on the other end was male, older, with the specific cadence of authority that didn't come from position, but from the long practice of being right in high-consequence situations. Ms. Tessier, my name is Admiral Harlan Droke. I'm retired from active service, but currently attached to the Inspector General's office in a consultancy capacity. A brief pause. I've been briefed on Sergeant Van's situation and on events at Mercy Hargrove Medical Center. I'd like to meet with you this morning. She sat up. Where? He gave her an address, a federal building downtown, which she knew by sight but had never entered. He said 8:30. He said there would be someone at the entrance to meet her. He said nothing else, and she didn't ask, because the call had already told her what she needed to know, that whatever Kendrick had set in motion last night had reached a level she hadn't fully anticipated. She washed her face, drove back to her apartment, changed, and was outside the federal building at 8:22. The man who met her at the entrance was young, early 30s, clean-cut, the kind of unremarkable that was clearly practiced, and he walked her through security and up 2 floors to a conference room with a long table and a window that looked out over the gray harbor and 3 people already seated inside. Admiral Harlan Droke was exactly what his voice had suggested. Late 60s, compact and sharp-eyed, with the posture of someone who had spent decades in rooms where posture communicated things words couldn't. Beside him sat a woman Nora didn't recognize, mid-40s, civilian clothes, with a legal pad and the contained attention of someone who was there to document rather than decide. Across from them, with his left arm in a partial brace that hadn't been there yesterday, and a color that was still not good but better than it had been, was Marcus Van. He looked at her when she came in. She looked at him. She looked at the brace. "You moved him," she said, to no one in particular. "Last night," Droke said. He gestured toward the chair across from him. "Please sit down, Ms. Tessier." She sat. She looked at Van. "How are you doing?" "Better than I look," he said. "That's a low bar." Something crossed his face that was almost a smile. "Fair." Droke set both hands flat on the table, which was apparently how he indicated that the room was now his. "Ms. Tessier, we've reviewed the recording from Trauma Bay 2 at Mercy Hargrove. We've also reviewed Dr. Finch's formal complaint, his addendum, and the medical record as it currently exists in the hospital's system." He paused. "The record as it currently exists does not match the recording." She kept her face neutral. "In what way?" "The chest X-ray findings have been reclassified. The upper right lateral finding that you flagged, the one that indicated the developing tension pneumothorax, is documented in the current record as having been identified by the attending during his primary assessment." Droke's voice was even. "It was not. The recording is clear on this. The attending completed his primary assessment without noting the right-sided finding. You identified it and flagged it verbally, twice, before performing the intervention." The room was quiet for a moment. "He altered the record," Nora said. "Yes." She'd known this was a possibility. She'd told herself it was a possibility since 6 in the morning 2 days ago, when she'd walked out of the hospital with her badge in Delphine's hand. Knowing it was possible and having someone in a federal building say it out loud were different weights. "The intervention you performed," Droke continued, "was correct, timely, and in the circumstances the only available action that would have prevented the patient's death within the subsequent 4 to 7 minutes. The recording supports this. Sergeant Van supports this. 2 of the 6 medical staff present in the Bay have provided informal statements to our team that support this." "2," she said. "The others are employed by the same institution that accepted Finch's complaint. Their reluctance is understandable." He paused. The 2 who spoke did so because they understand that what happened in that bay was not what the current record describes. Van shifted in his chair, and she could see the effort it cost him to hold himself upright, and she wanted to tell him to stop performing but understood that he wouldn't. "There's a second issue," he said. His voice was steadier than his color suggested it had any right to be. "Meridian." Droke nodded. "The 2 individuals who were in the hospital lobby are connected to a private contractor operating outside official oversight. Their interest in Sergeant Van's location relates to an ongoing operation that I'm not in a position to fully brief you on." He looked at her directly. "What I can tell you is that they did not identify the sergeant while he was at Mercy Hargrove, and the transfer last night was clean. However, their inquiry at the hospital created a secondary problem." "They talked to someone," she said. "They talked to several people, including, we believe, a member of the administrative staff who was involved in processing Dr. Finch's complaint." He paused. "We don't know yet whether that conversation was substantive or incidental. We're working on it." The woman with the legal pad was writing. The rain outside the window was finally, tentatively, beginning to thin. "Ms. Tessier," Droke said, "what we're going to ask of you in the next 24 to 48 hours is significant, and I want to be direct about what it involves." He folded his hands. We are going to submit the recording and the corrected clinical timeline through official channels to the State Medical Board and to the hospital's own review committee. We are going to do this in a way that makes the alteration of records visible and documentable. And we are going to ask you to be present at a formal review hearing that we expect will be convened within the week. Finch will be there, she said. Yes. He has institutional backing. He had institutional backing, Droke said, with a precision that told her something had already shifted in the last 12 hours that she didn't yet have full visibility on. The situation is changing. She looked at Van. And the meridian angle. If it comes out that you were the patient, it will come out, Van said simply. Not all of it, not the mission details, but my identity, yes. That's already in motion. He paused. Kendrick is handling the operational security piece. What matters for your situation is that I am a named witness to events in that trauma bay, and what I say happened and what the recording shows happened are the same thing. She looked at him for a long moment. You don't have to do this. You owe me nothing. That's not how this works, he said. Sergeant Nora. He said her first name with the directness of someone who had decided formality was taking up too much space. You put a needle in my chest in the dark with someone screaming at you to stop. You were right, and he was wrong, and he tried to punish you for being right. His voice was quiet, but it had an edge that cut. That is not something I sit still for. That is not something anyone in my world sits still for. The woman with the legal pad stopped writing for a moment, which was the first time she'd stopped since Nora sat down. Droke gave it a beat and then said, Are you willing to participate in the review proceeding? Nora thought about it. Not the answer. The answer had been assembled since she walked out of the hospital 2 mornings ago, but the shape of what was being asked and what it meant. She thought about the patient who was not going to recover and was not going to be in a recording, and she thought about the one who was. She thought about Delphine looking up and looking back down, and about the floor nurse who hadn't looked away and who had told Finch she'd been in the building. She thought about the nursing board and the word suspension and what it would mean to have that word as the last entry on a record that also contained 15 years of being consistently right when it mattered. Yes, she said. She left the federal building at 10:15 and drove directly to Delphine's. Delphine lived 20 minutes from the hospital in a narrow house on a street with mature trees, and she was home because it was her day off. She opened the door and looked at Nora with an expression that mixed relief and wariness in equal measure, and said, I've been trying to reach you. I know. Come inside. They sat at Delphine's kitchen table, which was covered in a thin layer of the organized chaos of someone who used surfaces actively, and Delphine poured coffee and didn't ask where Nora had been, because Delphine was a woman who understood that some information was volunteered when it was ready. Finch called another all-hands this morning, Delphine said. He addressed the team, talked about protocol and unauthorized interventions and protecting the integrity of clinical practice. She wrapped her hands around her mug. He was very confident. He altered the record, Nora said. Delphine went still. The X-ray findings. He reclassified them in the documentation to show that he'd identified the right-sided issue. Nora said it evenly. He didn't. The recording shows he didn't. Delphine was quiet for a long moment. Outside, a car passed. A dog barked somewhere down the block. Who else knows? Delphine said. People who can do something about it. Nora held her gaze. Delphine, I need to know who was at the nurse's station when I came through yesterday. Who saw me? Delphine's expression did something complicated. Petramos. She's been with the floor team for 8 months. She and Finch have... She stopped. He's been mentoring her. That's the word people use. She told him she saw me. She called him within an hour of your visit. I found out because she asked me to confirm the time she'd seen you, and I told her I hadn't seen anything. Delphine's voice was careful and flat, which was true in the narrowest possible sense. Thank you, Nora said. Don't thank me. I should have... Delphine stopped again. She pressed her lips together. I should have backed you in that bay. When he told you to step out, I was watching the monitor and I knew what the right side finding meant, and I said nothing. She looked at her coffee. I've been doing this job for 11 years, and I watched a patient nearly die because I didn't want to lose my position. The kitchen was quiet. "You have a family," Nora said. "So do patients," Delphine said, and it came out harder than she intended, and she exhaled and set down her mug. "I want to give a statement. If there's a formal review, I want to be on record." "There's a formal review," Nora said, "likely within the week." "Then I'll give a statement," she paused. "Nora, what you did in that bay, the needle placement, the angle, the speed. I've been a nurse for 16 years. I've never seen a civilian do that. I've never seen most surgeons do it that way." She looked at her directly. "Who are you?" It was the same question the whole story kept asking, from different angles, and Nora had been deciding how to answer it for most of her adult life. She thought about Marcus Van's face when she'd walked into his room, about the word commander, and what it had cost him to say it through a torn chest and a sedation hangover. "Someone who did a different job before this one," she said. Delphine looked at her for a long moment. Then she nodded slowly in the way that meant she understood the boundary and was going to respect it. "Okay," she said. "What do you need me to do?" By 2 p.m, the situation at Mercy Hargrove had shifted in a way that Nora could feel from outside the building. She learned it in pieces. From Kendrick, who called to say that the hospital's legal team had received a formal records inquiry from the IG's office. From Delphine, who texted that Finch had called in sick for the afternoon session and that the department head had convened an unscheduled meeting with the chief of staff. From her union rep, who finally returned her call and said in a cautious voice that she'd heard something significant was happening and that the review timeline might be accelerating. Nora sat in a coffee shop 3 blocks from the motel and drank bad coffee and waited and thought. She thought about Finch, about the architecture of his certainty, the way it had been assembled so completely that there was no apparent gap in it, no daylight between what he believed and what he performed. She'd worked with surgeons like him before. Not many. Enough to understand that the ones who were genuinely brilliant and genuinely certain were the most dangerous specific combination in medicine, because their track record of being right made the moments they were wrong functionally invisible. To the system, to the people around them, sometimes even to themselves. She didn't want him destroyed. That was the honest answer. She wanted the record corrected, and she wanted her job back, and she wanted the nursing board to receive accurate information rather than a constructed narrative. And if those things happened, Finch would face whatever consequences came from having altered a medical record and filed a false complaint, and those consequences would be his, not hers. She just wanted the truth to be the version of events that existed officially. That was the whole thing. That was all it had ever been. Her phone rang at 2:47. The number was the federal building. "Ms. Tessier." Droke. "We've confirmed that someone within Mercy Hargrove's administrative structure had 2 contacts with a Meridian-associated individual in the 48 hours following Sergeant Van's admission." A pause. "The contact was initiated by the Meridian side, but the information that was exchanged included details about the complaint process and the identity of the nursing staff involved in Sergeant Van's care." She set down her coffee. "They know my name," she said. "They knew your name before this. What they now have is context. Your connection to the case, your suspension, your current status outside the building." He paused. "We believe the intent is to use your suspension as cover. If you're discredited professionally and already outside the hospital, you become a less credible source if the sergeant's identity is ever questioned." She worked through the logic. "They want me to stay suspended. They benefit from it, yes." Droke's voice was careful. "Which means Finch's complaint, whether he knows it or not, serves a purpose beyond the professional dispute. Someone is using it." The coffee shop was warm and low-lit and full of people doing ordinary things, and none of them were listening to what she was hearing. She looked out the window at the street. "Does Finch know?" she said. "We don't believe he has any awareness of the Meridian connection. We believe he filed the complaint for exactly the reasons he stated, to protect his position and preempt the consequences of his clinical error." A pause. "He's being used. That doesn't excuse the record alteration, but it does complicate the picture." She exhaled slowly. Complications were the texture of everything in the spaces Marcus Van occupied, and by extension in the spaces she used to occupy, and apparently by extension again in the space she now occupied against her preference. "When is the review hearing?" she said. "We've requested an expedited schedule. We expect to hear back by end of business today." He paused. "Ms. Tessia, I want you to understand something. The review will surface things about your background that you've kept private, your service record, your qualifications, the nature of your prior career." A pause. "We need to establish why your intervention was not reckless. To do that, we need to establish who you are." She'd known this was coming. She'd known it since Van said commander in a hospital room, and the word had landed in the hallway outside his door like something she couldn't put back. "How much?" she said. "Enough. Not operational details, not classified specifics, but your rank, your training, your combat trauma experience." He paused. "The people on that review committee need to understand that what you performed in that trauma bay was not an untrained nurse exceeding her scope. It was a former combat trauma officer performing a procedure she has executed in the field under conditions significantly more difficult than a hospital bay." She stared at the table. "I left that world for a reason." "I know," Droke said, "and no one is asking you to go back to it. We're asking you to let it speak for you once, in this room, in this context." Outside, a bus went past. The rain had fully stopped and the light on the wet street was cold and clear. "Okay," she said. She was about to end the call when Droke said, "There's one more thing." She waited. "The floor nurse who reported your unauthorized hospital visit to Dr. Finch, Petra Moss." A pause. "She called the IG's office this morning. She wants to make a statement." Nora frowned. "About what?" "About a conversation Dr. Finch had with her on the morning of your suspension. She says he asked her to be available as a witness to your presence in the building, before you'd visited, before he'd filed the addendum." Droke's voice was carefully neutral. "He told her what to look for and where to look for it. The report she made to him was not spontaneous observation. It was the outcome of specific instruction. The coffee shop, the ordinary people, the cold light on the wet street." "He set it up," she said. "It appears so." She sat with that for a moment. Not with the anger of it. There would be time for that later, or maybe there wouldn't. Maybe the anger was a luxury she'd skip. But with the specific, clarifying weight of knowing that the thing she was facing was not careless or accidental. It had been constructed. Piece by piece, in the hours after she'd walked out of that bay, a man had assembled a structure designed to make her disappear from the story. She thought about Marcus Van lying on the gurney with his oxygen saturation falling and the monitor alarming, and Finch moving toward the wrong side with certainty arranged on his face. She thought about 11 seconds and a 14-gauge needle and the hiss of escaping air. "When is the hearing?" she said. "Tomorrow morning, 8 o'clock. Droke paused. "The committee will include 2 physicians, a nursing board representative, the hospital's chief of operations, and a legal representative from the IG's office. Dr. Finch has been informed and has been asked to attend." "He'll have lawyers." "He will have a lawyer," Droke agreed. "We will have the recording, the corrected clinical timeline, 3 witness statements, a statement from Sergeant Van, and your service record." He paused. "I think the comparison will be instructive." She thanked him and ended the call. She sat in the coffee shop for another 10 minutes, not thinking about anything in particular, letting the information settle into the architecture of what came next. She thought about what it meant to have kept something private for years, and then have it opened in a conference room in front of people who hadn't earned the context. She thought about why she'd left, and what she'd been trying to become, and whether what she'd become was different enough from what she'd been that the distinction still held. She thought about a man named Morales who had a daughter named Nora, and about a nurse in a hallway who had looked up and looked down and carried the weight of that choice for 2 days, and about a charge nurse who'd said, "I want to give a statement," with the specific relief of someone who had been waiting for permission to do the right thing. She thought about Garrett Finch walking into a review hearing tomorrow morning, believing he was still the most certain person in the room. She left a tip on the table and walked out into the cold, clear air of a Delacroix afternoon, and her phone rang before she reached her car. It was a number she didn't recognize. Local area code. "Ms. Tessier." The voice was male, smooth, with a practiced warmth that didn't quite reach its own surface. "My name is Preston Lyle. I'm a managing director with Meridian Group. I understand you're involved in some professional difficulties at the moment. A pause. I was hoping we could have a conversation before tomorrow's hearing. I think I can offer you a perspective that would be genuinely useful. She stopped walking. How did you get this number? She said. We're very good at what we do, he said pleasantly. I'll be brief. There are aspects of the situation at Mercy Hargrove that go beyond a professional dispute between a nurse and a surgeon. You know that. I know you know that. Another pause. I'm calling to tell you that the path you're currently on leads somewhere complicated, and that there are alternatives that would be better for everyone. The afternoon light was cold and even and clear. What kind of alternatives? She said. The kind where this dispute resolves quietly, you receive a settlement, and everyone moves on without certain information becoming part of a public record. His voice stayed pleasant throughout. Sergeant Van's situation is sensitive. The more visibility this case receives, the more complicated that sensitivity becomes. I'm sure you care about his safety. She looked at the street, at the ordinary afternoon, at the last of the rain evaporating off the asphalt in thin ribbons of vapor. I'm going to the hearing tomorrow, she said. A pause. Shorter than it should have been. Ms. Tessier, and I'm going to record this call and forward it to Admiral Droke, she said, which I've been doing since you introduced yourself. The line went quiet. Then, you need to think very carefully about— I have thought carefully, she said. I've been thinking carefully for 48 hours. I'm done thinking. She paused. Don't call this number again. She ended the call. Her hands were steady. She checked. She'd learned to check because the body sometimes told you things the mind was too controlled to admit. And they were steady, and her breathing was even, and somewhere in the last 2 days something had resolved in her that she hadn't realized had been unresolved. She got in the car, tomorrow morning, 8 o'clock. A conference room with a long table and people who needed to understand what had happened in Trauma Bay 2 at 1:54 in the morning 3 days ago, and why the person they'd been told to doubt was the only person in that room who had known exactly what she was doing. She started the engine. Her phone buzzed. A text from Kendrick, 3 words. He's asking for you. She read it. Then she looked at the time. Then she thought about a man in a federal medical facility with a brace on his arm who had been awake for 2 days when he should have been unconscious, making phone calls, activating contingencies, doing the work of someone who understood that the debt was already owed and that the clock was already running. She put the car in reverse, and that was when her phone rang again. Not Kendrick, not Droke, not the smooth voice of Preston Lyle, but a number that resolved on her screen as Mercy Hargrove Medical Center's main line, and when she answered it, the voice on the other end was not Delphine's and not anyone from HR. It was Garrett Finch. His voice came through the line flat and stripped of the confidence she was used to hearing in it, which was the first thing that told her the call was not what she'd have expected 2 days ago. I need to talk to you, Finch said. She kept her hand on the gear shift and didn't put the car in reverse. You filed a complaint against me and then filed an addendum designed to accelerate my suspension. Talking to me directly is not how that process works. I know. A pause. I know how it works. I'm calling anyway. She said nothing. Outside, a pedestrian crossed at the corner and disappeared around the building. The engine idled. I didn't know about Meridian, he said. She let the sentence sit there. Didn't confirm, didn't respond, waited to see what came after it because what came after it would tell her more than the sentence itself. Someone contacted me, Finch said. 2 days before Van came in. I didn't know his name then. I didn't know anything about him. Someone contacted me through a colleague and suggested I might want to be aware that a patient coming into the facility had a sensitive background, and that the best approach would be to handle the case privately and not involve unnecessary staff. He stopped, started again. I thought it was standard protocol, some kind of advanced coordination. I didn't ask enough questions. You were primed, she said. Yes. And when I flagged the right-sided findings, I already had it in my head that you were a problem, that you needed to be managed. His voice was flat throughout, not apologetic, more like someone reading back a decision tree they'd constructed under bad assumptions. I reacted to you the way I'd been set up to react. She thought about Preston Lyle's smooth phone manner, about Meridian running parallel vectors, about the administrative contact that Droke had mentioned, the 2 phone exchanges in the 48 hours after Van's admission. They got to you before the patient even arrived, she said, through an intermediary. I didn't know the source. A long pause. When I filed the complaint, I believed what I wrote. I believed my assessment was correct, and that your intervention was unauthorized and potentially dangerous. I was operating from a picture that had been constructed for me, and I didn't see it. He stopped. And then I altered the record because I was scared, which was separate, and that's mine. That's not Meridian. That's me. She sat with that for a moment. The honesty of that last part was its own specific thing, and she filed it. Why are you calling me? She said. The hearing is tomorrow morning. If you have information about Meridian's contact with you, that belongs in the room with Droke. I know. I've already called the IG's office. I spoke to someone named Kendrick for 40 minutes this afternoon. He paused. I'm calling you because I wanted you to hear it from me first. Because you're the one He stopped. Because you're the one. She didn't say anything for a long moment. The record alteration, she said finally. That's still in the system. I know. I've submitted a correction through the hospital's document management portal. It's flagged for administrative review. The original reclassification is visible in the edit history. A pause. I can't undo it. I can only document it and let the process handle what comes from it. That process is going to cost you your license, she said. Not cruel, just accurate. I know that too. She looked at the street, at the light changing at the corner, at the city doing what cities did, moving and ordinary and entirely indifferent to what was happening in a parked car on one of its minor streets. Is there anything else you need to tell me? She said. The nurse, Petramosa. He exhaled, a thin, tired sound. I put her in a bad position. I asked her to observe and report before I had any legitimate reason to expect you'd return to the building. That wasn't fair to her, and it wasn't... He stopped. I'll address that in the hearing. Droke will address it in the hearing, she said, whether you do or not. I know, he said. Nora... Don't, she said. Not harshly, just clearly. A beat of silence. Tomorrow, she said. Be in the room. Say what you told me. Let the recording be what it is. She paused. That's all I'm asking you to do. She ended the call before he could respond. She drove to the federal medical facility where they'd moved Van, which took 40 minutes and involved a gate check and a brief exchange with a uniformed staff member before she was escorted into a room that was smaller than a hospital room but considerably more secure, with equipment she recognized from a different context, and with Kendrick sitting in the corner doing something on a laptop that he closed when she came in. Van was propped up at an angle that looked uncomfortable. His color was marginally better than this morning, and his eyes were clear, which was the thing that mattered. Finch called me, she said by way of greeting. I know, Kendrick said. We monitored the call. She looked at him. From my personal cell. Standard precaution given Meridian's access to your number. He didn't apologize, because people like Kendrick operated in a space where apology was a less useful currency than information. His account matched what he told us. The intermediary contact checks out. We've traced it to a consultant with documented Meridian adjacency. He paused. He's cooperating. She looked at Van. You look worse than this morning. I feel slightly better than this morning, he said, which I'm counting as progress. How's the arm? Functional. He moved it slightly to demonstrate and didn't fully succeed at not wincing. Nora, Lyle called you. And I recorded the call and sent it to Droke. Something in Van's expression shifted. Not quite relief, more like the specific resolution of a variable that had been in play. Good. That's useful. What does Meridian actually want with you? She said. Not the cover version. What's the real interest? Van looked at Kendrick. Kendrick looked at the closed laptop. A beat passed. There's an operation, Van said carefully. Ongoing. My team gathered information during the course of it that is relevant to several parties who would prefer it not be documented. Meridian represents at least one of those parties. He paused. My being found in that parking structure was not accidental. Someone knew where I was going and timed the approach for when I'd be isolated. Someone on your team, she said, or adjacent to it. His jaw tightened slightly. We're working on that. The wound on your right side, she said. The blade angle. That was deliberate placement. Yes. Designed to look like secondary trauma from the shooting, so that when you died in the hospital, if you died, it looked like complications from a GSW. Yes, he said again. And if the attending surgeon had proceeded with the plan he had when you flagged the right side finding, that's exactly what the death certificate would have shown. She sat down in the chair beside the bed. She thought about 11 seconds, about how specifically small the margin had been and how many things had had to go right, or wrong, depending on how you measured it, for the sequence to land where it had. I need to ask you something, she said, for tomorrow. Anything. When you give your statement about what happened in the Bay, you'll be identifying yourself. Your real name, your rank, some portion of your operational status. She looked at him directly. Does that create a problem for you? For the operation? He thought about it. Not performing the consideration, actually thinking, which was something she appreciated about him. The operation's already partially exposed. Meridian knows I survived and knows which facility I was in. The cover ID held long enough to get me moved, but it's burned now. He paused. Going on record as the patient in that bay actually helps us. It creates an official documentation trail that makes it harder for certain people to claim the events didn't happen the way they happened. You're using the hearing, she said. We're using each other, he said without apology. You need the truth in the record. We need the truth in the record. That's not a conflict of interest. That's alignment. She almost smiled. You sound like a lawyer. I've spent a lot of time around lawyers lately, he said. Some of it is starting to stick. Kendrick made a sound from the corner that might have been something. She stayed another hour. They went through the sequence of events from the night of the trauma. Her account, his partial account of what he'd been conscious for, the points of intersection and divergence. Kendrick documented it. It was the kind of work that had no drama in it, just precision and patience. The building of a timeline that would hold up when it mattered because it had been assembled carefully. She left at 9 in the evening. Van was asleep before she reached the door, which was the first genuinely reassuring thing she'd seen since this started. She went back to the motel. She slept. The hearing was in the hospital's administrative conference suite on the 6th floor, which was a space normally used for department head meetings and board presentations. Long table, upholstered chairs, a wall screen for projected materials, and a particular kind of filtered corporate air that was different from the air in the clinical floors, and that always reminded her of decisions being made at a distance from their consequences. She arrived at 7:50. Droke was already there with a woman she hadn't met before, a state nursing board representative named Calloway, 40-ish, with a precise manner and reading glasses on a chain. The IG's legal representative was a man named Fassbender, who had the contained energy of someone who had read every document in the room twice. Delphine was in the corridor, waiting, which Nora hadn't expected, and they exchanged a brief look that contained more than either of them said. Finch arrived at 7:58 with one lawyer, not two, which told her something about the overnight recalibration of his position. He looked like he hadn't slept. He was dressed carefully, the way people dress when they're aware they're being assessed, and he nodded at her when he came in, a nod that was small and weighted with something she didn't try to name. The chief of operations, a tall man named Braslow, who had an administrator's characteristic quality of maximum opacity, arrived at 8 exactly. He sat at the head of the table and the room organized itself accordingly. Braslow opened. He reviewed the purpose of the proceeding in the careful language of someone who had been briefed thoroughly and intended to say nothing that deviated from the brief. He confirmed that the session was recorded, that all parties had been informed of the recording, that the outcome would be non-binding, but would inform subsequent formal actions by the nursing board and any relevant investigative bodies. Then he handed it to Droke, because Droke had made certain things clear to certain people in the past 24 hours, and the room understood the shape of that clarity. Droke started with the timeline. He had it projected on the wall screen in a simple document format, timestamps, events, source references for each entry. He walked through it without theater, which was more effective than theater would have been because there was no gap for anyone to dismiss as performance. The chest X-ray finding at 14 minutes post-admission. The verbal flags, 2 of them, time-stamped, both captured on the Bay's audio. The attending's response to both flags, also time-stamped. The patient's deterioration at 22 minutes. The intervention at 23 minutes and 14 seconds. The oxygen saturation drop in recovery, graphed on a chart that was simply the patient monitor export. Then the medical record, the current version, the reclassification of the right-sided finding. The edit history showing when the reclassification had been made, 4 hours after the event, well outside the window in which a contemporaneous documentation correction could be justified. The room was very quiet. Fassbender introduced the recording. Nobody had warned her that watching it would be different from having been in it, but it was. In the Bay, she'd been moving, operating, responding to what was in front of her. On the screen, she could see all of it simultaneously. Finch's movements and her movements and the monitor behind them and the team around them. She could see the exact moment she flagged the X-ray finding, her hand pointing at the upper right lateral field, and she could see Finch's eyes not moving to where she pointed. She could see his attention stay on the left side, and she could see the monitor begin its decline, and she could see herself step forward, and she could see his face when he turned, and she could already see, even before it happened, the shape of the decision he was about to make. She heard herself say his SAT is coming up. She heard him say that is not the point. She heard herself say that is exactly the point. Calloway, the nursing board representative, made a note. Braslow's face was neutral in the specific way of someone managing a significant reaction. Finch's lawyer had gone very still. Finch himself was looking at the table. Droke introduced the witness statements next. Delphine's, 2 of the Trauma Bay team, Van's written statement from this morning, notarized. He introduced the transcript of Nora's call with Preston Lyle, flagged in bold the offer of a settlement contingent on withdrawal from the hearing, noted the surveillance-adjacent knowledge of her personal contact information. Then he placed a single additional document in front of Braslow. This is an amended incident record submitted by Dr. Finch himself at 8:47 yesterday evening through the hospital's document management system, Droke said. In it, he corrects the reclassification of the right-sided finding and attributes the initial identification to the nursing staff. He also acknowledges that the original reclassification did not reflect the clinical sequence accurately. He paused. The edit history is appended. Braslow looked at the document. He looked at Finch. Finch looked up from the table. His face had the specific pallor of a man who had spent the night making decisions that he understood were the right decisions and that were going to cost him significantly and had made them anyway. Dr. Finch, Braslow said, would you like to speak to this document? Finch's lawyer put a hand on his arm. Finch looked at the hand. Then he looked at the wall screen, which still showed the paused recording. Nora's face frozen in the moment of the intervention, one hand on the needle, her attention on the monitor, her body completely still. He looked at Nora. The record was altered at my direction, he said. The reclassification was not accurate. The nursing staff, Ms. Tessier, identified the right-sided finding before I did. Her intervention was the correct intervention, and it was timely. He paused. The complaint and the addendum I filed were... His lawyer gripped his arm more firmly. He stopped. The complaint was not an accurate representation of events. Calloway's pen moved. Braslow was quiet for a moment. Then he said, "Thank you, Dr. Finch," in a tone that contained no gratitude at all. What? The formal portion of the hearing ran until 11. What followed was a series of procedural conversations from which Nora was largely excluded, which was standard. The parties with institutional standing negotiated the immediate steps, while she sat in the corridor with her coffee, and Delphine sat 2 chairs down saying nothing because there was nothing necessary to say. Fassbender came out at 11:40 and told her the nursing board was withdrawing the suspension effective immediately. She would be reinstated to active status pending a final confirmation that was, he said, a formality at this point. The IG's office had opened a formal investigation into the record alteration. The Meridian contact would be addressed through a separate process he wasn't at liberty to detail. And Finch, she said? Fassbender paused. His surgical privileges have been suspended by the Chief of Operations pending the outcome of the records investigation. The State Medical Board will be notified today per mandatory reporting requirements. He paused again. His lawyer is already in conversation with the board about a voluntary surrender process. I think they're trying to get ahead of it. She nodded. Ms. Tessier? He hesitated, which was not his natural mode. For what it's worth, in 20 years of doing this work, I've seen a lot of rooms where someone altered a record to protect themselves and it held because nobody had the standing to challenge it. He paused. You had standing. I had a recording, she said. You had both, he said, and walked back into the conference room. She and Delphine sat in the corridor for another 20 minutes. At some point, Delphine got a second coffee from somewhere and handed it to her, and she drank it without remarking on the fact that it was better than the hospital's standard offering, which meant Delphine had gone to the machine on the 4th floor that nobody knew about except the people who'd been here long enough to learn the building's small secrets. At 12:15, Braslow came out and stood in the corridor with the posture of a man delivering information he'd have preferred not to have to deliver. He told her the reinstatement was confirmed. He told her the hospital would be issuing a formal retraction of the complaint and addendum. He told her the incident would be documented in the internal record as having been based on a misrepresentation of clinical events. He did not apologize. She hadn't expected him to. When can I come back to work? She said. Monday, he said. Then, after a pause, if you're willing. I'll be there Monday, she said. He nodded and walked back through the conference room door, and she thought that was probably the end of it as far as he was concerned, which was fine, because her interest had never been in Braslow's reckoning. Her interest was in the record, and the record was going to be correct. She texted Kendrick. Hearing concluded. Suspension lifted. He responded in under a minute. Good. Van wants to know. She texted Van's number directly, the one she'd called from the hospital room. It's done. Rest. He didn't respond immediately, which meant he was probably actually resting, which was the best news she'd gotten in 4 days. She stood up. She looked at Delphine. Buy you lunch? Delphine said. No, Nora said. I need to go home and sleep for about 14 hours. After that. After that, yes, she said. Absolutely after that. She took the elevator down. She walked through the main lobby without glancing toward the waiting area. The 2 Meridian men were long gone, swept up in whatever drokes people were handling in the parallel track that she wasn't going to be fully briefed on and had made her peace with. She went through the automatic doors and out into the sharp, cold clarity of a Delacroix afternoon that had finally, completely decided to be clear. She walked to her car. She sat in it for a moment without starting the engine, the way she'd been doing for 3 days every time she got into a car, and she thought about what came next. Not the job. She knew what the job looked like. She'd been doing it for years, and Monday was Monday, and she'd be there. But the other thing, the thing that had been named in a hospital room by a man with a rough voice and a specific word, Commander. The door that word opened and the room it opened onto, and whether she could step back out of that room now that someone had made her stand in it again. She didn't have an answer yet. She started the engine. Her phone buzzed on the passenger seat. Not a call. A text. From a number she didn't recognize, but the area code was DC, and the message was 6 words long. We need to talk. Not Meridian. She picked up the phone and read it twice, and set it back on the seat. And the thing she felt was not fear, and not quite surprise, but something closer to the sensation of a door she'd thought was behind her, turning out to be in front of her, and the question of whether she was walking toward it or away from it, resolving as she pulled out of the parking space, into the realization that she hadn't decided yet, and that whoever was on the other end of that text already knew that and was counting on it. She drove 3 blocks and pulled over. Not because she'd decided anything, because she needed to be still for a moment, and the car in motion didn't give her that, and the decision she was circling, or that was circling her, which felt more accurate, was not the kind that resolved well under momentum. She put the car in park and looked at the text again. We need to talk. Not Meridian. 6 words that told her almost nothing and almost everything. Not Meridian was doing the most work. Someone had anticipated her first assumption and preempted it, which meant whoever sent this understood her enough to know what she'd assume, which meant they were not a stranger to her history, which meant the DC area code was not coincidence, but context. She thought about who knew enough of her background to make that preemption. The list was not long. It had gotten shorter since she'd left, because the people in that world moved around, and some of them moved out of it, and some of them moved out of everything, and the ones who remained were the ones who'd built their lives so completely inside the work that the work and the life were no longer distinguishable. She thought about the hearing this morning, about Droke in that room, the way he'd handled the evidence, the economy of it, about something he'd said to her at the federal building 2 days ago that she hadn't fully registered at the time. I'm retired from active service, but currently attached to the IG's office in a consultancy capacity. Attached, not assigned. Consultancy, not employment. She picked up the phone and called the number. It rang once. Tessier? The voice was female, measured, with the specific flat effect of someone who had learned to speak without telegraphing anything and had been doing it long enough that the flatness was no longer performance. I wasn't sure you'd call back. I wasn't sure either, she said. Who is this? My name is Aldred. I work in a capacity that doesn't have a clean title. I'm going to be straightforward with you because I've read enough of your file to know that anything other than straightforward is going to cost both of us time we don't have. A brief pause. What happened at Mercy Hargrove this week created a documentation trail. Van's identity, your intervention, the Meridian contact, Lyle's phone call to you, that trail runs through official channels now. It's real, and it's not going anywhere. I know that, Nora said. What you may not know is that the documentation you generated, the timeline, the recording, the chain of events, has confirmed a separate piece of information we've been working to verify for 8 months. Something Van's team brought back from their operation. A pause. The person who set Van up, the leak adjacent to his team. We had a candidate. Your hearing gave us the confirmation. She was quiet for a moment. How? Lyle called you 40 minutes after Finch submitted his record correction. Aldred's voice was even throughout. Lyle shouldn't have known about the correction that quickly. The only way he could have known is if someone inside the hospital's administrative structure with Meridian ties saw the correction flag and alerted him. We traced the alert. Another pause. The same person who had 2 contacts with Meridian after Van's admission, the one Droke mentioned to you. She's not administrative staff. That was her cover. Nora sat in the parked car on a quiet street in Delacroix and processed this. You had someone inside the hospital, she said. We had someone inside the hospital, Aldred confirmed. Placed 8 months ago when we first started tracking Meridian's interest in Van's operation. We didn't know what she was looking for until this week. She paused. You generated the situation that made her move. When you went back to Van's room, when the hearing became real, when Finch's correction created a paper trail she needed to manage, she moved, and we saw her. Who is she? That's being handled, Aldred said, which was not an answer but was clear about why it wasn't. What I'm calling to tell you is that Van's operation has a path forward now that it didn't have 72 hours ago. The leak is contained. The material his team recovered can be properly processed. What happened this week, what you did, how it unraveled, created that path. Nora looked out the windshield at the ordinary street. A woman walking a dog. A kid on a bicycle. The light changing at the corner. Why are you telling me this? She said. Because you're owed the context, Aldred said, and because I want to ask you something. Ask. A pause. There's a position, not active, consultancy, like Droke. Trauma protocol development for personnel in high-risk operational contexts. It involves training, some field assessment, no direct combat role. Another pause. It would require you to formally acknowledge the parts of your background that you've been keeping private. Your service record, your qualifications, all of it. But you did that this morning in a conference room in front of 6 people. The door's already open. She thought about standing in front of the conference room wall screen this morning, watching herself on the recording in the trauma bay. About the word commander said through a rough throat in a dim hospital room. About a daughter named Nora who was 4 years old and didn't know any of this. I have a job, she said. I know. I'm going back Monday. I'm going to keep going back. I'm not asking you to stop. Aldred's voice didn't shift. I'm asking you to consider doing both, part-time, Consultancy basis. Your terms. A pause. People like you don't come along often, Tessier. People who can do what you do in a trauma bay and also understand the context those traumas come from. That combination has value that a hospital shift doesn't fully use. She didn't answer immediately. How long do I have to decide, she said. Take the time you need, but I'd appreciate an answer within the week. You'll have it, she said. She ended the call and sat for another minute and then drove home. She slept for 11 hours. Not the clean, gone sleep of someone without concerns, but the heavy, fitful sleep of a body that had been running on maintenance power for 4 days and was finally, grudgingly, allowing itself to shut down properly. She woke twice, once at 2 a.m. when a car alarm went off on the street below, once just before dawn when her own mind surfaced with the specific urgency of someone who had forgotten something important, realized she hadn't, and went back under. She got up at 7:30, made coffee, stood at the kitchen window and watched the harbor in the early light, which was clear today, the kind of clear that Delacroix produced rarely but memorably, where the water went from gray to silver to almost blue as the sun came up and the hills behind the eastern waterfront went from silhouette to detail. She thought about the consultancy. She'd been thinking about it since Aldred's call, in the background layer where she did her real thinking, the part that ran underneath the surface activity and assembled conclusions while the conscious mind was doing other things. She knew what the answer was going to be. She'd known it since Aldred said your terms, which was the phrase that told her this was a different offer than the one she'd walked away from 9 years ago. Different in structure, different in what it asked, and specifically designed by someone who'd read her file carefully enough to know where the previous offer had broken down. She didn't make a decision that morning. She let it sit. She called her union rep to confirm the reinstatement paperwork was processing. She called Delphine and they talked for 20 minutes about nothing medical, which was its own kind of restoration. She went for a run along the harbor and didn't think about anything except the cold air and the water and the way her body felt when it was doing what it was designed to do. She called Kendrick in the early afternoon. "Van," she said when he picked up. "Better," he said. "Fever broke last night. They're going to keep him another 4 or 5 days minimum, but the trajectory is good. Can I see him? He's been asking when you were coming." Fine. The drive was the same 40 minutes, the same gate check, but the room felt different when she walked in. Less the controlled stillness of acute crisis management, and more the impatient, restless energy of a person who was healing faster than the protocol wanted and was annoyed about the gap. Van was sitting up fully, not the angled prop of yesterday, but actually upright, with a tablet on his lap that he set aside when she came in. He looked better. Not well. He still had the specific hollowness of significant blood loss not yet fully replaced, and his left arm had a brace that he was clearly going to be wearing longer than he liked, but present, engaged, more himself than she'd seen him since the bay. "Aldred called you," he said, "yesterday. She mentioned she was going to." He studied her. "What did you tell her?" "I told her I'd have an answer within the week." "That means you're thinking about yes." "It means I'm thinking," she said. He accepted that, which she appreciated. He had the quality of someone who understood the difference between a decision and the process of arriving at one, and who didn't confuse impatience for information. "How are you actually doing?" she said. "I've been shot before," he said. "This was more complicated than most." A pause. "But I've been in worse rooms. The parking structure wasn't the worst room I've been in." "That's a low standard." "I'm an optimist," he said, which was clearly not true, but said something about what passed for humor in the world he operated in. She sat down. The afternoon light in the room was thin and even. Outside the window there was a courtyard with a few winter bare trees and a bench where nobody was sitting. "The leak," she said. "Aldred told me it was confirmed." He nodded. Something moved in his face that was complicated. Not quite anger, something older and more specifically painful. She understood it without needing him to explain it. The person who'd sold his position had been close enough to know it, which meant close enough to have been trusted, and betrayal at that proximity left a mark that ran deeper than the wound in his chest. "You know who it was," she said. "Yes?" "I'm sorry," she said. He looked at her for a moment, and the thing in his face settled into something quieter. "Yeah," he said. "Me too." She didn't push it further because there was nothing useful in pushing it, and they both knew that. "There's something I want to say to you," Van said after a moment, "and I want you to let me say it without deflecting." She looked at him. "You saved my life twice," he said. "Once 9 years ago in a location neither of us is going to name. Once in a trauma bay at 2 a.m. with someone telling you to stop." He paused. "And then you spent 4 days getting punished for the second one, and you didn't break and you didn't fold and you didn't take the exit Meridian offered. You just—" He stopped. Started again. "You just stayed true to what you knew was right, even when the institution was working against you." He looked at her directly. "I've operated in some hard environments. I've seen a lot of people under a lot of pressure. That's not common." She held his gaze. She didn't deflect. She let the words land in the place they were aimed at, which was not comfortable, but was honest. "It nearly wasn't enough," she said. "If the recording hadn't existed, but it did," he said, "and you knew to count on it. You knew what you'd done, and you knew the record of it existed, and you trusted that the truth was going to hold if you could get it into the right room." He paused. "That's a kind of courage that doesn't look dramatic. It's just steady. You were steady." She looked away for a moment, out the window, at the winter trees and the empty bench. "Morales?" she said. "How is he?" "Good. Really good, actually. He's stateside now, works training cycles. His daughter is 4 and apparently runs the household." A small smile crossed his face. "He's going to want to reach out when this settles." "I'd like that," she said. She stayed another hour. They talked about the consultancy. Not whether she'd take it, but what it would look like practically, what the rhythm of it was, what she'd have to formalize versus what she could keep private. He'd worked adjacent to similar arrangements and knew the texture of them. She asked questions and he answered them without selling it, which was the right approach. When she left, she stopped in the doorway. "Get some sleep, Sergeant." "You too, Commander." She walked out and didn't correct him this time. The formal outcomes arrived over the following 10 days in the specific bureaucratic stagger of institutional processes that move slowly even when their conclusions are clear. The State Medical Board's notification came first, a formal letter to Mercy Hargrove confirming receipt of the mandatory report regarding Dr. Garrett Finch and initiating a disciplinary review under the State Medical Practice Act. The review would assess the record alteration, the misrepresentation in the complaint, and the clinical sequence that had led to both. The board's timelines were their own, running in months rather than days, but the initiation was documented and real. Finch's voluntary surrender of his surgical privileges came 4 days after the hearing. It was filed through his lawyer and accepted by the board as an interim measure pending the review's completion. He remained employed by Mercy Hargrove in an administrative capacity for approximately 2 weeks before that too ended, in a mutual separation that the hospital's communications office described in language that said nothing and meant everything. Nora heard about it from Delphine, who had the information because she was the kind of person hospitals ran on, someone who knew the institutional body's actual temperature at any given moment, not the official one. Delphine delivered it without satisfaction, which Nora respected. There was nothing to celebrate in what had happened to Finch, not really. There was only the correction of a record that had been wrong, and the process that followed from that correction, and a man who had to carry the weight of a decision he'd made in a bad hour that turned out to have a long shadow. Petra Mossi left the floor team voluntarily at the end of the second week. She submitted her resignation without explanation. Delphine said she'd seemed young for her job, even before everything, which was maybe the kindest way to frame what had happened to someone who'd been put in a position she hadn't fully understood and had made choices she'd have to figure out how to carry. Nora didn't go looking for more information about either of them. The record was corrected. That was the thing she'd needed, and it had been achieved, and the lives of the people involved in achieving it were going to continue to be complicated and imperfect in ways she had no control over. That was just what lives were. She went back to work on Monday. The floor was the same floor, the same smell, the same light, the same rhythm of shift change and patient load, and the 100 small decisions that a 12-hour nursing shift required. Some of her colleagues said nothing and went back to work immediately, which was the best response and the one she was most grateful for. A few said brief things. "Welcome back. We're glad. in the direct and slightly awkward register of medical people expressing personal feelings, which she received without embarrassment. Delphine handed her a new badge and the morning's patient board and said, "Bay 3 has a query chest pain that isn't presenting clean. Start there," which was also in its own way welcome back, and she knew it. She worked the shift. She was tired by the end of it in the good way, the way that came from the body having done what it was supposed to do rather than from sustained crisis. She drove home. She ate something. She slept. The following Saturday, she called Aldred. "Yes," she said. A beat of silence. Not surprise, more like the small pause of someone finishing one column before starting the next. "On your terms," Aldred said. "The nursing stays. That's not negotiable. 20 hours a week consultancy? No more. No active field role? Consultancy only. I want to see the protocol frameworks before I agree to anything specific, and I reserve the right to withdraw if the scope changes without my input. All of that is workable. And I'm not relocating," she said. "Whatever this involves, it doesn't involve me leaving Delacroix. That's workable too." A pause. "Tessier, you can have this on terms that respect what you've built here. That's why I called it consultancy and not employment. You're not going back to what you were. You're adding to what you are now." She thought about that framing. It was accurate in the way that the best framings were. Not reassurance designed to close a deal, but an actual description of what was being offered. "Send me the framework documents," she said. "I'll read them this week." She ended the call and sat for a moment in the quiet of her apartment on a Saturday afternoon, with the harbor visible through the window and the winter sun low enough to come in at an angle that made the whole room gold for a few minutes before it dropped below the building line. She thought about 9 years of keeping a door closed, about the specific weight of carrying a past that you'd decided not to use, not because it was shameful, but because the person you'd been building since was someone you'd worked hard to become, and there was a fear, not irrational, that the old self was larger and that if you opened the door it would come back through and take up all the room. She'd been wrong about that, she thought. Not because the old self wasn't large. It had specific gravity, and Van's voice saying Commander had proved that the weight of it hadn't diminished. But because the person she'd built in the 9 years since was solid enough to hold the door open without being pulled through it. The trauma nurse and the combat trauma officer were not opposites. They were built from the same material. She just hadn't let herself see them together. She made tea and took it to the window and watched the last of the winter light over the harbor. 3 weeks later, Marcus Van was cleared for limited activity, and Kendrick drove him up to Delacroix on a Thursday afternoon in weather that had turned cold but clear. They met at a coffee place on the waterfront that Nora liked because it had windows all the way across the front, and you could see the boats from every table. Van was in civilian clothes and moving carefully, but moving without the braced arm, which was progress. He looked like what he was, a person who was still putting themselves back together, but who was fundamentally sound and knew it. He got his coffee with the specific intentionality of someone who'd been on a restricted diet for weeks and intended to take the return of normal food seriously. They sat at a table by the window and watched a container ship making its slow way toward the harbor entrance, and didn't talk about anything significant for 20 minutes, which was its own kind of significant. Then Van said, "Morales wants to video call. He's asking if you're open to it." "Tell him yes," she said. "Tell him anytime." He nodded. He turned his coffee cup in his hands. Outside, the container ship was almost to the channel markers, moving with the enormous slow patience of very large things. "I keep thinking about that bay," he said, not looking at her. "I wasn't conscious for most of it, but for the part I was, for the part where I could hear what was happening." He stopped. "He told you to stop and you didn't." "He was wrong," she said simply. "I know. But it still cost you." He looked at her. "That's the part I can't make clean in my head. That being right cost you as much as it did." She thought about how to answer that honestly. Not the reassuring version, not the version where she said it worked out and left it at that. "That's how it usually goes," she said. "Being right in a room full of people who've already decided you're wrong doesn't feel like being right. It just feels like being very tired." She paused. "The record catches up eventually, if the evidence exists and if you stay long enough for it to catch up. But there's always a cost between the moment and the correction. That's just what it is." He was quiet for a moment. Does that change whether you do it? No, she said. No, he agreed. She looked out at the water, at the container ship now clearing the channel markers, beginning its cautious turn toward the open sound. She thought about what it meant to move through a room full of noise that was designed to drown you out and do the thing anyway. To be unheard, and then to do the right thing, and to wait for the record to catch up. She thought about how many rooms she'd been in where that was the shape of it, where the work was not dramatic and not acknowledged and not witnessed by anyone who had the power to change what it meant, and how she'd done it anyway, year after year, because the alternative was to not do it, and that alternative had never been one she could hold in her head for long without it disintegrating. She thought about the nurses she knew who had been in those rooms too, who were in them right now, in hospitals and field stations and urgent care centers and trauma bays across every city she'd ever worked in or moved through. The ones who saw what others missed because they were trained differently or thought differently or had learned in the specific way experience teaches, where to look and what it meant when they found it. The ones who said something and were told to step back. The ones who stepped back and stayed true anyway. The ones who stayed. She thought about what it cost to stay. And she thought, not for the first time, but more clearly than before, that the ones who stayed were not doing it for the recognition, because recognition was irregular and late and sometimes never came. They were doing it because they understood, in a way that certain kinds of experience burned into you permanently, that the patient on the table was the point, that everything else, the hierarchy, the title, the complaint form, the suspension notice, the voice saying step back, was noise around a center, and the center was a person who needed the right decision made in the next 30 seconds and didn't care at all who made it. That was the thing she'd never been able to explain to people outside the work, that the stubbornness they saw, the not stopping, the not folding, the staying steady when the room was against her, wasn't stubbornness. It was just her understanding clearly what the point was. Van was watching her. "You're going to be all right," he said. "I know," she said. She meant it. Not in the thin way of someone trying to believe something, but in the specific, settled way of someone who had looked at what the last week had cost and what it had returned and had done the math and found that she was still standing, still employed, still herself, and that the record now said the true thing. That was enough. It was not nothing. It was in fact the whole thing. She picked up her coffee. Outside, the container ship had completed its turn, its enormous hull now pointed south toward the open water, moving with the slow and absolute confidence of something that knew exactly where it was going. "Come on," she said to Van. "Drink your coffee. I have to be at work in 4 hours." He looked at her for a moment with an expression she couldn't fully read, and then he picked up his cup, and they sat in the winter light by the water. And it was not a perfect afternoon, and the world outside was not a resolved or finished place, and nothing that had broken had fully mended. And she was there anyway, present, clear-eyed, ready, which was the only way she had ever known how to be.